6 and 19 new this morning. If you're a parent, you can relate to this story. One of the biggest fears out there is just not being able to help your child.
We even said to doctors, what could have we done differently as parents? What could have we done to prevent this?
This morning, our Pete Servakis will introduce you to one family who coped with a sudden childhood stroke and the message they want to share with you. Pete, good morning.
Well, Susan, when tangled blood vessels in the brain rupture and cause a stroke, time is of the essence. For one family in the state of Florida, survival was a miracle.
1 year ago, the Christie family gathered around the dinner table when 10-year-old Neil started acting strangely.
Neil goes, Mom, I don't want to eat. I don't feel good.
Now it's slurred speech is kicking in. We can't figure out what he's saying, but he kept on saying, I'm numb. I'm numb.
They couldn't believe what a 911 operator told them.
She said to us that, your son's having a stroke.
Neil had an AV fistula, similar to AVM, but without the tangle of abdominal blood vessels connecting arteries and veins in the brain.
We were able to stabilize Neil and get him to the operating room quickly to do a craniotomy and evacuate hemorrhage and stop the bleeding.
After being kept in a coma 10 days in the ICU, plus rehab, Neil was finally sent home after 2 months and 2 surgeries.
I don't need any more canes. I don't need any assistance with walking. So that's one thing that's already improved. Another thing is putting on my brace by myself.
Has even learned to play video games one-handed with his older sister and is improving every day.
I need it.
Doctor wants other parents to know the symptoms to watch for: sudden headaches, numbness, vision loss, or slurred speech. And Neil's mom urges parents to do this.
To ask further questions and to assess, do they need to be seen by a doctor?
Scary moments for that family. Now, Neil's mom says he should regain 80% of his normal functioning with continued physical therapy. The doctor in that story says, of course, anytime you have a child who might show a sign of a stroke, get them to a doctor immediately.
You just don't think of
That's
kids
exactly
having
it,
a
right?
stroke.
You're like,
My goodness.
that can't be happening, so it must be something else, right?
All right. Very enlightening. Thanks, Pete.